you, Senator Urquhart. The question is the bill be read a second time. Senator Lyons.
Thank you, Mr Acting Deputy President. And I rise today to also oppose the Australian National Preventative Health Abolition Bill, which seeks to repeal the Australian National Preventative Health Agency Act 2011 and seeks to abolish the Australian National Preventative Health Agency, ANPAH. And it's all very well for the Abbott government to dismantle key agencies, particularly in the area of health, and claim these functions, or some of them, will simply be picked up by the Department of Health. I've lost count of the number of times the Abbott government has said this, but in saying this, it demonstrates the Abbott government doesn't understand how you prioritise and focus. It is hard, probably impossible, to get focus on particular issues in large government agencies. And this is not a criticism of hard-working public servants, but more how work is allocated, measured and reported on. You can, of course, give someone a range of issues to be responsible for, but how do you focus and deliver those improved health outcomes for the Australian community? Well, that was the whole point of the Australian National Preventative Health Agency. It provided that, a focus. And what the Abbott government doesn't understand is that focus in and of itself is a resource. And what the Abbott government also demonstrates is that it doesn't have a clear strategic agenda in health. Its only agenda in health is cuts, cuts and more cuts. And when it can't cut, it tries to shunt back to state governments the responsibility for various programs by claiming health is a state issue. We've just seen that with the abolition of the Health Workforce Australia. Now delivering competent health workforce for the future is the planning and delivery responsibility of states and territories. Well, good luck with that plan. The Australian National Preventative Health Agency's focus was on alcohol, tobacco and obesity, all significant lifestyle risk factors associated with chronic disease. Approximately 40% of potentially preventable hospitalisations for chronic conditions are associated with alcohol, tobacco or obesity. Firstly, I want to take a few minutes to focus on tobacco, and these alarming facts are on ANPAH's website, which also has a note that it will soon be taken down. Smoking rates among some of our most disadvantaged population groups, people who are long-term unemployed, sole parents, people with mental health issues, those who have a substance use problem, people in prison, people who are experiencing homelessness, or people who are Aboriginal and or Torres Strait Islander. The disadvantaged population for those groups, the smoking rates, remain much higher, in some cases 5 times higher than the general population, and of course that contributes to poorer health, higher death rates and increased financial stress. It is also the major contributor to the health gap between Aboriginal and non-Aboriginal Australians. And it's the difference in mortality between the least and the most disadvantaged in Australia. High smoking rates are contributing to health and financial inequalities in the most disadvantaged groups in our communities. Social disadvantage and smoking rates are intrinsically linked. As levels of disadvantage accumulate, smoking rates increase. There is merit in tailoring cessation services to the different needs of disadvantaged groups and delivering cessation strategies within organisations that are already accessed by these groups. Specialist services, but within an existing trusted organisation. So those social and community service providers have an important role to play in tobacco control and cessation, but of course only if they were adequately funded to provide this support. An example of some of the work that ANPAH was doing was a partnership with the Warman community in East Kimberley in Western Australia, who worked with the Australian Council on Smoking and Health to identify some issues in their community. So 450 people, what that community wanted was some real tangible outcomes: tobacco control education and awareness by children and youth, tobacco control education and awareness by mothers, decisions by the Community Council to make areas of the community smoke-free. 30 community youth painted and used no smoking signs in their homes, and they also wanted to see the health impacts and the economic costs of cigarettes conveyed to children, youth and mothers. Based upon feedback and recommendations from the children and youth, and supported by the community through the manager of Gidja Health, the council agreed to make 4 areas of the community smoke-free: the basketball courts, the school grounds and the new recreation centre, and a buffer zone in the front of the community store. The community has raised levels of awareness around tobacco, resulting in more smoke-free homes, a number of residents who have accessed quit services, and heightened awareness by community leaders of the issues around tobacco and harm caused by tobacco in the community. And this has created an increased desire to develop and implement tobacco control and quit strategies. Health staff and youth workers have been trained in brief intervention, smoking cessation, drug awareness and testing. And tobacco control and health workers have been introduced to the community and to one another. Tobacco control is becoming a priority in the Warman community, and all of that will now be shut down with the moving of that agency within the broad parameter of the Department of Health. And on alcohol, the Australian National Preventative Health Agency strategic plan outlined strategies which included providing advice on options to strengthen policies and programs through price-related mechanisms, regulation, responsible marketing and the protection of children from exposure to promotion, and on strengthening standards and advice around the supply of alcohol to minors and alcohol-related licensing. But in the past, when in opposition, the Coalition didn't support all of these measures, particularly in relation to control on pricing. Supporting the development of policies and programs that will promote a change in the drinking culture among young people and play a leading role in the ongoing rollout of government and community-supported programs that address binge drinking. And I don't think anyone in this place would disagree that binge drinking is a problem in our communities. And further, ANPAH also supported and contributed to national dialogue on drinking culture, public and individual safety and alcohol-related harm. And again, more examples in the Aboriginal community in Western Australia, which presumably won't exist once this agency's folded up. So through the David Wirrapunda Foundation, a netball program aimed at Aboriginal and Torres Strait Islander young women between the ages of 12 to 17 years, and the program uses netball as a way of engaging participants and educating them about the harms of binge drinking. A very worthwhile, tailored, specifically targeted program that was the recipient of funding, and there were a number of programs throughout Western Australia, in Bunbury, in Mandurah, in Kellerberrin, Merredin, Kwinana, Perth and Katanning. So both metro and regional areas had access to the David Wirrapunda binge drinking netball program, which was funded through ANPAH. In the Eastern Goldfields, through the YMCA, another preventative program aimed at 12 to 24-year-olds in the Kalgoorlie Kalgoorlie-Boulder area are utilising a whole-of-community approach and working through a number of community partners to again address binge drinking in that community, and presumably that program will now be cut or curtailed because of the abolition of ANPAH. And the last program in Wyndham, which aimed to address binge drinking among young people aged again 12 to 24 by raising awareness of harms, providing alternative activities, mentoring and referrals. And Wyndham is a town where money should be going in, not coming out through cuts in program by the ill-thought-out cut mentality of the Abbott government. So Labor established ANPAH in 2011, and we established it to take a leadership role in preventative health for Australia, to coordinate, to analyse and advise on key statistics and data in relation to chronic disease and prevention, to provide a focus, to hold one agency clearly responsible in a nationally coordinated way to increase outcomes in related to tobacco, obesity and alcohol. ANPAH has been providing leadership across the non-government health promotion and primary care sector too. And again, what we see, no analysis being done by the Abbott government, no review undertaking, just, oh, we can do without that, we'll lump it all back into the Department of Health and somehow it will be all right. Well, it won't be all right, because these issues, these chronic issues in our community need their own focus, not to be bundled up as part of an overall strategy. They need specific strategies in and of themselves, and that's what Labor provided. And at least the Abbott government, if it could stand with a clear conscience and say, we reviewed these programs and guess what, look, they didn't work as well as we thought, we want to provide a different approach. But no, we're not seeing any of that. We are just seeing, again, this slash and burn that goes on right across our sector, but particularly now focused in health. We will just slash and burn this program because we want to take some money out. Well, that is so short-sighted to take money from preventative programs, because guess what? All we'll be doing is crowding out our accident and emergencies. We'll see chronic disease increase, and we'll see governments of the future having to put more money into managing people in hospitals instead of putting money in at the top of the stream into preventative measures. I mean, what sort of short-sighted government thinks that abolishing an agency which focused on preventative health is somehow a good outcome for the health of Australians? It is not. The money in health needs to be at the preventative end, which of course will lessen over time the amount of money we need to put in at the tertiary end through our hospitals, through our doctors. That is common sense. But of course, common sense is never what we see from the Abbott government. It's just about cutting and burning. Any program that the Labor government had in place that was successful, that's got outcomes here that are measurable, can look at the communities that I've just outlined, you can go and measure those outcomes. No. No analysis, no measurement, just a cut, cut, cut mentality, someone else's problem, certainly not the Abbott government's. And of course, ANPAH has been playing a central role in collaborating across the health sector to embed preventive health as central to the delivery of healthcare, and that's what we need. Prevention's got to be a key part of every health professional's message when they sit with a patient or a client, that they talk and engage that patient into what else that patient can do to improve their own health outcomes. They need facts and figures at their disposal, but they also need to be able to refer off, to have confidence that the agency they're referring to or the program that they're suggesting the patient could undertake is there and readily available. And in particular, ANPAH has been working with Medicare locals, but we know what's happening to those, and that has been to enhance the primary care sector's focus on prevention. That is what we have to do. And the agency was responsible for providing evidence-based advice to governments, evidence-based advice, not a slash and burn, not a cut, but actual evidence where governments could make decisions, and to look at and to support and help with the development of preventative health policy. And ANPAH was set up to provide reports, because what we didn't want, certainly what Labor didn't want, was an agency that became focused on itself without being able to report. So its role was to report regularly on outcomes, the outcomes identified in its strategic plan around preventative health measures. And the agency was managing a research fund to gather information needed to develop new preventative health policies and programs, with a focus on translating that research into practice. Because many times we see good research, but we don't see it translated into practice, and that's exactly the role that ANPAH were undertaking, and that will be gone too. And of course, not only are we seeing the abolition of these agencies if this bill that Labor isn't supporting is successful, of course the National Partnership Agreement on preventative health will be terminated. So again, we're saying to the states, go it alone, to the states and territories. Find your own outcomes. We don't really care. We're not interested if suddenly outcomes are better in one state than another. The Abbott government is simply not interested in any kind of national preventative health message, because abolishing the National Partnership Agreement without anything taking its place is saying very clearly to the states and territories, oh, and by the way, you'll have to deal with this all on your own. And that will just create more uneven outcomes and different measurements and different strategies being played out right across Australia, and no central agency collecting and analysing that information. Again, a really short-term outcome, certainly not wrapped up in any kind of strategic plan at all, because anyone with half a brain in health would tell you you must have a strategic plan that looks at preventative measures, but the Abbott government doesn't seem to have that, because it's only got a plan about cutting. And of course, Labor recognises the value and the need for long-term, sustained investment in preventative health. It's not going to happen in the life cycle of a federal government. It does need to be sustained, and there needs to be a long-term investment so that we see the benefits to health outcomes, and ultimately we'll see savings to our health system, because that's what a long-term investment can achieve. If we've got good preventative measures in place, we'll have less people being admitted to hospital. That just makes common sense. And that is why Labor established a dedicated agency to drive that agenda over a sustained long-term period and provide the infrastructure for this to continue beyond the budget cycle. Labor built ANPAH so that prevention became a central focus of our health system, a central focus. That is where it needs to be. And ANPAH was directing action specifically around obesity, tobacco and alcohol use. And many of the most important organisations working directly in public health all support ANPAH, and those include the National Health Foundation, the Public Health Association and the Royal Australian College of Physicians. And Labor will oppose this bill for the short-sightedness that it demonstrates in relation to the key priorities facing Australia's health today, and for the lack of vision, no plan, no vision, that the Abbott government has in relation to understanding the challenges facing the health system into the future. And of course, this bill comes on the back of a raft of other broken promises: the GP tax, the increase to the cost of pharmaceuticals, the increase to specialist services, the attack on Aboriginal health organisations, and on the list goes. Labor will always be the party of healthcare. By contrast, Australians know the Coalition simply can't be trusted when it comes to providing a strong, sustainable and universal healthcare system. Thank you, Mr Acting Deputy President.
Thank you.